So, welcome, Dr. Ruth Heidrich.
Thank you.
Nice to have you.
Good to be here.
So, the first question was, what was your upbringing like in terms of diet? Your family kind of followed the SAD diet, and did they have any interest in nutrition or fitness?
No, it was the typical Western diet of meat with every meal. It was oatmeal for breakfast, but eggs and bacon on weekends and, the standard American diet.
Right, right. And at what age did you, well, let's see, I think I remember your story is you got diagnosed with breast cancer. Is that right? At what age did that occur?
At age 47.
47.
Which
okay.
was really strange because I had been a runner for 14 years at that time. I got into fitness back in the 60s and started running after reading Dr. Kenneth Cooper's book, Aerobics. Started with just short distances and gradually ran further and further, did races and got up to marathons and had done several and thought I was the fittest, healthiest person around and had no idea that there was a cancer lurking in my breast until one day I was in the shower and I felt a lump and of course had it checked out, and the doctor said, "Oh, you're too young and too healthy. It's probably just benign fibrocystic breast disease." Okay. So they did a mammogram and it turned out negative, and so we were all reassured. But then they decide, well, let's go ahead and do a biopsy, an excisional biopsy where we remove the lump. So I said, okay, let's do that. And of course, that's a whole chapter in my first book, A Race for Life, because it turned out shockingly to be infiltrating ductal carcinoma, which is a moderately fast metastasizing cancer. And the lump was, when it's so large that you can feel it, it's been there a while. And in fact, it had probably been 8 to 10 years growing from a single cell up to the size of a golf ball, literally.
All right. And let me ask you, prior to that, would you say that your health had been, you were running a lot and you felt you were physically fit. Would you say that you had the annual cold or flu that most Americans are subject to, or were you healthier than most in that respect?
I think I was healthier than most in that respect, except for I fought chronic constipation and was told, well, 3 or 4 times a week is normal for some people. Well, I've since found out that no way is that normal. I also had been diagnosed in about 1977 or 8, diagnosed with arthritis because I had such achy joints, and of course went to the doctor and they said, oh, we've got this new drug which is going to be so helpful. It's called naproxen or Aleve now. It's over the counter, and yes, it did take care of the symptoms, but little did I know it was not helping the arthritis, just masking, turning off that alarm that I had of pain. I also had adult acne, which, I couldn't believe. Here I am in my 40s, but doctors had a pill for that too, and that was tetracycline, so I was taking that. But other than that, I really felt that I was healthy and eating a good diet. I had taken my first nutrition course as a freshman in college and was told that, you need good, healthy protein, and that you find in animal flesh, and you need lots of calcium that's found in dairy. So I did have a lot of, in fact, it was low-fat dairy, carnation powdered milk. And I had that a lot, as well as when I found out that red meat was questionable, I immediately dropped it and then increased the chicken and fish. So that's where I was at the age of 47 with this.
And that kind of happened concurrently with the diagnosis as you tried to address the disease nutritionally?
Well, I hadn't thought about the cancer having a nutritional factor because I thought that I was eating a good diet from what I had learned in college.
Right.
So right after the diagnosis, still in a state of shock and finding out that it was cancer and that they needed to do more surgery because even though they thought they removed the whole tumor, there were no clear margins. So it had already spread beyond the breast, as it turned out, to my bones. I had hot spots in my bones. I had an elevated liver enzymes, and it turned out also a lump in my lung, a tumor that.
Were there predictions that you would probably die from this?
Well, they wanted to start chemotherapy and radiation right away and said, we're hoping we can get it all, and that even though we can't predict how long you're going to, whether it's going to be 3 months, 3 years, we just will start this treatment right away. So I was being transferred from the surgical clinic over to the oncology clinic, and that takes about 2 weeks. So I hadn't gone back to work after the surgery and happened to be reading a newspaper that had a 2-line ad in it, a notice, wanted women with breast cancer to participate in diet research study. And I thought, oh, this is perfect because I'm sure it's not my diet, not with my background in nutrition. And let's find out what caused my cancer, being so healthy and a marathoner and all that. So ran to the phone and got right through to Dr. John McDougal, who happened to be living in Hawaii at the time, in fact, quite close to where I was.
And were you born and raised in Hawaii?
Not quite born. I was raised in Hawaii. My father and grandfather were born and raised in Hawaii. I happen to have been born in California and then brought back. So almost, I had no memory of anything else other than Hawaii growing up.
Let me ask you, before you continue, let me ask you a favor. If you can still hear and see all right, can I have you scoot back from the computer just about 6 inches to a foot? And that'll give the that'll kind of give you a better image. That's oh, okay.
It's darker, right?
Yeah, it is darker. Okay, maybe come back to where you were. Sorry about that.
That's all right.
But okay, so you got involved in this program. You went to see Dr. McDougal, and what did he say?
Well, he was trying to find subjects for his research, and he wanted these women with breast cancer to change their diet, to go to a low-fat, strict vegetarian, or vegan, as was little known back in the early 80s, and no oils. And I said, well, wait a minute, I know I'm eating a healthy diet with no red meat and low-fat dairy. And he said, no, that's not what I'm talking about. This is no animal products whatsoever. And no oil, not even olive oil. And I'm thinking, well, let's just see if this is going to make a difference. And also, because he'd said bring your medical records, he was looking at my high cholesterol, and he says, you know, with a cholesterol of 236, you're at as high a risk of dying of a heart attack as you are the breast cancer. And I'm going, whoa, wait a minute.
You know, that's very interesting, and I was going to ask you, since you were so involved in the running, you were probably familiar with Jim Fix, and he died of a heart attack, right?
Right. Was it? Yeah. His coronary arteries were almost 100% blocked, like 97, 96, 94. And I was heading down that same path, and running is not enough, and I found that out the hard way. But as soon as I changed my diet, I found out that what a difference, you know, that constipation disappeared. Excuse me, arthritis disappeared. Anyway, I also, because I had not gone back to work, I was watching television a little bit and just happened to see the Ironman triathlon being performed right there in Hawaii. And I had done the Honolulu Marathon several times, so I knew that that was something that was attainable. But to do a 2.4-mile swim first, and then a 112-mile bike ride, which was the equivalent of riding all the way around the island of Oahu, and then run a marathon, I'm thinking, oh my gosh. And And then I thought, having changed my diet, I immediately felt more energy, faster recovery, and thought, I'm going to do the Ironman triathlon and show people that a vegan diet is not only good for cancer, but also heart disease and maybe colon cancer and arthritis and all these things and all that.
Amazing.
Yep.
Can I ask you, I want to hear all about the Ironman. Let me ask you a few questions about when you went to Dr. McDougal. And my understanding is because of what he told you, you told the other doctors, I'm not doing chemotherapy, I'm not. And then you took on this nutritional approach. And how was it for you in terms of transitioning to a vegan diet, both in terms of personal capacity to do it and the social effects of that?
The transition for me was easy. Once, and this is because he showed me the research. He reached around, pulled open a file cabinet drawer and said, this is the research that I'm basing this on. Here are the animal studies that show if you implant a cancerous tumor on them and feed them a high-fat diet, the cancer spreads rapidly. If you give them a low-fat diet, the cancer shrivels up and falls off. The epidemiological studies are here that show that women from countries who eat the most animal products, the highest fat diet, have the highest rates of breast cancer, and conversely, those who, mostly the poor countries that can't even afford to eat animal foods, have little or no breast cancer. So between those two groups of studies, I was convinced that he was on the right track.
Let me ask you something in relation to this. As you saw how effective this approach was for you in terms of your breast cancer, did you sometimes find it frustrating that there were these huge organizations geared towards breast cancer research that are often going down alternative lines that do not have the same success rate? What are your thoughts on that?
Well, let me go back to when I went back, your other question about when I went back to the oncologist and told him I was refusing chemo and radiation because I was in an experimental program to prove that diet could reverse the breast cancer. They scoffed and said, this is ridiculous. We know diet has nothing to do with breast cancer. And besides, you can't get enough protein, you can't get enough calcium, the essential amino acids. So I went right back to Dr. McDougal and said, this is what my oncologists are saying. And he laughed and said, of course, that's what they're going to say because they don't study nutrition in medical school. But here's the research again. And
right.
So
and that was
back and said, okay, I'm going to do it. Now,
was that 1974, 1980?
It was 82.
82. Okay.
Yeah.
Okay.
And of course, with the vegan diet, my cholesterol, the next time I went back with the new blood test results, my cholesterol, the real test was within 2 months, it was down to 129. It went down in 2 stages. 3 weeks later, it was 160 and then 129. And Dr. McDougal said, that's where you need it to be. Your risk of a heart attack just went away. So there were all these good things happening. And one of the things, now to get to your question about these other organizations and getting this information out, I immediately volunteered for the American Cancer Society's Reach to Recovery program. This is when a woman is diagnosed with breast cancer, they call the Reach to Recovery program and they send a volunteer out who has a similar condition to act as kind of a mentor and hold their hand as they go through this.
Support, yeah.
And so I had Lois was my Reach to Recovery mentor, and she had the same type of breast cancer I did. So when I told her about this information that I'd gotten from Dr. McDougal, her first response was, oh, I could never give up cheese. And sad to say, she died of her breast cancer having spread about a year later. And it's so sad because, I tried to get her to change. Now, What happened to me as I started talking to other breast cancer patients, I would tell them, you've got to change your diet. Well, when the Cancer Society found out I was doing that, I got, quote, fired. I mean, literally. They said, you cannot interfere with the treatment recommended by the doctors. And I said, I cannot not tell them that diet is so critical. And they said, well, that's it. I went to the Susan B. Komen Foundation trying the same tack and got the same results. Diet has nothing to do with breast cancer. So
that's really amazing, and you're reminding me of a phenomena within the medical community where they characterize experiences such as yours as anecdotal.
Yeah.
And I wonder, at what point does anecdotal become immense enough to overcome this resistance within the popular culture to see what's in front of their face?
You tell me. I'm waiting. It's been 31 years, and in fact, the first couple of years, I too thought it was anecdotal, and I wasn't sure it would happen with other patients, and there were so few others who were doing this. And then when I hit 5 years, that so-called magical time when you're cured, Dr. McDougal said, you're never cured. You can manage it, but if you were to go back to eating the SAD diet, I can guarantee you your cancer would flare up again. So when I hit 10 years, I thought, there's more evidence and I'm coming out stronger. When I hit 20 years, I said, people, it's working. And at 30 years, so the longer I went, the more sure I was that this was the answer. And in terms of finding a cure for this cancer, if you don't get to the cause of the disease, you're at risk for any other type of cancer, whether it's ovarian or uterine or colon or lung, liver, it's other cancers, and heart disease.
It's really interesting how in modern medicine there tends to be this diversification and specification with various diseases. But if you look at it from a nutritional perspective, it's really a pretty simple cause. You're putting the wrong fuel in and you get all these diseases manifesting in different ways in different people. But oftentimes it's the same nutritional cause. Yep.
I don't know how we convince people that, at least people now, most of them know how to pronounce vegan. Back then,
right.
In fact, I was at my dentist for a checkup last week, and he said, "Are you still on that vegan diet?" Yep, 31 years now. And he said, well, it's working for you. And I get that too. Well, it's working for you, as if it wouldn't work for him or all these other people.
Yeah,
it's very frustrating.
And amazing, this mental wall.
Yeah. Modern medicine's approach is you go to a doctor with a symptom and they have this pill or surgery. And like, for example, statins. High cholesterol, leading cause of heart disease, and what people do is eat the foods that raise the cholesterol and take a pill to lower the cholesterol. Nobody thinks about just don't eat it in the first place.
It's so simple. I know. Yeah.
And blood pressure. You know how many people have hypertension? And they eat the foods that clog the arteries, increase the blood pressure, and then take a pill to try to lower it. One drug doesn't work, they add another drug. If that doesn't work, they add a third. And then you've got all these side effects. Just don't put the foods in your diet in the first place. The same with diabetes. That's another disease that's rampant. That same diet causes the glucose to increase in the bloodstream, and you're blocking it from getting to the muscles. And then if you're sedentary, the muscles can't use it anyway. So
right, but it's not the sugar. It's like the whole community is focused on the sugar. Yeah. It's not the sugar's not the problem. It's the fat.
Exactly. It creates a wall that keeps the glucose from getting to the muscles.
Right.
So with almost every disease, and that's why I wrote the book Senior Fitness. When my publisher, after I wrote A Race for Life and a cookbook, my publisher called me and said when I turned 70, how about writing a book on not just cancer, but all the other diseases, the ones we're just talking about? So each chapter covers a different aspect of both the dietary and the exercise component of heart disease, cancer, diabetes, osteoporosis, arthritis, even dementia has been shown to have a dietary and exercise component to it.
Right, I'm seeing Alzheimer's. Alzheimer's, they're starting to see is perhaps connected with fat in the brain. So yeah,
Yep.
very interesting. Let me ask you, since for you it's the nutrition which alleviated and led you to recover from breast cancer, and the symptoms that would have led to a heart attack disappeared.
Right.
And did you notice? And you've already stated that with your physical fitness, you've noticed a faster recovery and perhaps more capacity in terms of distance and that sort of thing.
Oh, definitely.
But yeah, have you noticed other things in terms of, like, do you ever get colds anymore? Do you ever your arthritis is gone, you said?
Yeah.
So it's like I mean, is there any kind of unhealth that you experience? I see you have glasses.
Well, they're readers because
yeah, me too. I've got them too.
Yeah.
But in other words, for you personally, you've got this catalog of illnesses that have kind of disappeared.
Yep.
as you continued with the diet.
Let me see. Wrinkles. I got some wrinkles. But my dermatologist said that's sun damage from all the sun, being raised in Hawaii and doing Ironman triathlons where you're biking for 8 hours a day. I've done the Ironman in Kona, Hawaii, where the sun is really bright. And
Yeah.
I did kind of wear sunblock off and on, but I hated putting chemicals on my body, so most of the time I didn't. So
I was going to ask you about
paying that
yeah.
price for that sun exposure.
And do you still go without lotions, or do you use them now?
Shh, don't tell anybody.
I think that's Dr. Ruth. I think what happens is the skin cancer arises because the skin is eliminating toxins from the toxic diet. And the less toxins that are going in, the easier it is for the skin to function properly and less chance for skin cancer.
Another factor with this low-fat vegan diet is your immune system is more powerful and more capable of detecting and destroying cancer cells. So we're probably all producing cancer cells throughout our body because of just mutations and radiation from the sun or from flying or whatever. And if your immune system is doing its job, it's going to detect and destroy these before they have a chance to get a hold.
Got you. I was going to ask you, so because of Dr. McDougal, you came to a cooked vegan diet, and that had tremendous benefits, and it was a low-fat cooked vegan. I'll say that.
Right, no oil.
And then, how many years would you say you were on that before you began to explore raw food?
About 20 years.
20.
Yeah.
Okay.
Yeah, it did. There is nothing wrong with that diet whatsoever. I attended a conference, the Vegetarian Fest back in Johnstown, Pennsylvania, and I heard Doug Graham talk about the raw diet. And I thought, I hate cooking. I hate spending time in the kitchen when I'd much rather be doing something else, running, biking, swimming, and having fun. So
Right.
I thought I'd try it. In fact, my husband and I both said, okay, let's try it for 30 days and see what happens. And, we never noticed when 30 days was gone, Didn't even give it a second thought about going back to cooked foods. Now, that's not to say there's anything wrong with the McDougal diet. It is wonderful, and it's perfect for transitioning from a SAD diet. I do
Right.
raw because it's convenient, it's fast. Shopping is so easy. I go to the farmer's market and pick up loads of leafy greens and all kinds of fruits and other veggies, and we just cut them up and eat them. And it's food preparation is really quick. There's no cleanup. There's no waiting. However, if you will cook something for me, I'll eat it as long as it's vegan.
All right.
So,
well, I got the impression that a neat thing about you is that it doesn't seem like you took on the raw food diet for any. Well, I guess you heard this lecture from Dr. Graham, so maybe it got you thinking a little bit. But it seems to me that you kind of took it on after enjoying it. So you liked it so much that you didn't want to go back. It
Right.
wasn't like It wasn't like there was some reason other than you just felt better and you liked it better.
Yeah, exactly. And in fact, we do occasionally have a bean dish just for variety, although on my website I do have my daily vegan diet, which is pretty simple, but I get asked that question all the time. So can I tell people where to go?
Of course.
Okay.
Sure, please.
www.ruthheidrich.com. Really simple, but you got to know how to spell it. RuthHeidrich. And if you scroll around, I have a new webmaster, and Audrey Wild is wonderful. She just redid everything on it. And
it's a lovely site. It's very attractive.
thank
I like
you.
how you
Yeah,
did it.
I'm just tickled pink with the work she's done on it. And if you scroll around, you'll find Daily Vegan Diet, and I give in detail what both my husband and I eat every day. And there isn't a lot of variety because I believe that when the body is getting what it needs, it enjoys it so much it's not saying, well, we had this today, let's have something different tomorrow. We just like our greens and fruit. For breakfast primarily, and for supper it's greens and veggies. And
And
blueberries.
that's greens, not grains, right? So greens
Greens.
like
Kale.
kale, okay?
Actually, we buy these great big bags. It's almost like a gunny sack bag full of mixed organic greens. Earthbound Farms puts them out, and we get them directly from our retailer. Rather than break them up and sell them in small portions, she'll sell us the great big bags, and that lasts us for 3 or 4 days. And we grow kale.
Okay, you grow your own kale, okay.
Yep.
This brings up a huge area I'd love to explore with you a little bit. We're at about 6:30, so you just let me know if you get tired. But do you think at all about the caloric intake needed for you? Is that a concern at all? Do you just eat until you're satisfied?
The latter.
The latter.
Yeah.
Okay.
Yeah. When you're eating this way, the caloric density is low enough that you have to eat a lot. And
right.
I get a few emails from people that ask Dr. Ruth on my website about losing too much weight. And I say, you just have to eat more, you know. And,
right.
And people look at how much I eat and they say, how come you don't gain weight? And I said, because it's the calories I need. Plus, I do work out. I do kind of a mini triathlon every day. That's one of the things that I do. Another contrarian trait is I love daily running. A day without running is a day without sunshine, to paraphrase somebody else. It's just become a habit of 45 years now of running. It's something I do just like I brush my teeth. I enjoy it.
Well, I loved one of the points you made in your talk where you said that there's some misconceptions out there about the damage that'll be caused if you do extensive running continually. And maybe you could talk about that a little bit.
That brings up the subject of my 4th book, Lifelong Running, which just got launched.
All right.
Let's see, maybe.
Yes.
See that?
Fantastic.
There. Hey, this is
beautiful.
Kind of fun. You know? I could show you all kinds of things. But I told you about my editor calling me and asking me when I turned 70 to write Senior Fitness. He called me last year and he said, now that you've been running for well over 40 years, how about writing a book on lifelong running? Turns out when he edited my other books, he got to thinking, maybe I ought to start running. And he did. And he's now run, I think, 5 New York City marathons. He's run Boston. And in fact, you know, the Boston bombing, he had just crossed the finish line by a half an hour when that went off. He's going back again this year. So Martin Rowe then wanted to contribute his perspective about running to this book, Lifelong Running. So it's the first time I've collaborated with somebody in writing a book. And the title that they gave it, it's not my title, it's theirs, Lifelong Running, Overcome the 11 Myths About Running and Live a Healthier Life. So we organized it so each chapter covers one of the myths about running. And in one interview I just did yesterday was, how come more people aren't runners? And it's because they can't picture themselves as runners. They've heard all these negative things about runners. Doctors tell you get more exercise, but they never suggest running. They're told that running ruins your knees. Well, there's a long-term study out of Stanford University that compared over 1,000 long-term runners with 1,000 non-runners, no more arthritis than otherwise. And if both groups have been vegan, guess what? Neither would have arthritis. But most researchers, when they do research, they're not getting vegans as subjects in their studies, and that's probably one of the things that's holding the spread of veganism out. They have a truncated scale. It's my term for when you're comparing different diets. If they're both eating meat, you aren't going to be able to see any differences. You don't get the scale down below where the vegans would be, like a cholesterol, or the dermatologist study. They tell people all the time that diet has nothing to do with acne. That was based on a study done where all they did was vary the chocolate. It was a high-fat, sad diet. Both groups ate, except one had chocolate, the other didn't. Guess what? No difference in the acne.
Well, you know what? You know what's so absurd about this? When I was a teenager, I had horrible acne, and I got the tetracycline too. And this dermatologist said to me, I was eating fast food every day. And he said, oh, that has nothing to do with it.
Yeah.
Of course it does.
Yeah.
Of course it does.
Yeah, that's the truncated scale. That he was missing that whole lower section of the vegan diet.
Now I would say that I think also some vegan studies that have come out, unfortunately, we had, in the beginning of veganism, we had some vegans who were not eating that healthfully. They might have had high vegetable oil in their diets. They might have been trying to get enough calories, but they weren't trying to get it from fruit, and consequently they ran into problems. So that can skew off some of the vegan studies. But now I think, and myself personally, I was vegetarian for over 20 years, and the only reason I hadn't become vegan is I had attempted it and I never felt right, and now I've realized my mistakes. It was probably B12, maybe vitamin D, and then too much fat.
Right. And probably too many refined processed foods too.
Right. That's right.
In fact, what I say in A Race for Life, if it comes in a package, has a label, if Crinkles has a tin can or whatever, if man made it, don't eat it. So if it doesn't have a label, it's grown from the ground, and that's the way we should be eating our food. And cooking, we know it destroys vitamin C. It probably doesn't destroy any minerals, but we don't know about the other phytonutrients. There are thousands of them we haven't even discovered yet. Right.
One thing I want to ask you about, you had mentioned visiting these Mexican runners who are, I guess they're...
Tarahumara, yes.
Yeah, that's fascinating. And I noticed you had referenced the fact that they eat a kind of processed corn, which is, of course, I don't know if that's a complex carbohydrate, but a carbohydrate. And do they just mix it with water and they eat that?
Yes. They carry little pouches tied to their waistband, and when they go for their up to 48-hour races, this is their nutrition, is this powdered corn. It's not really processed. It's just dried and ground up into a powder that when they mix it with water, it's edible that way. And they also run pretty much barefoot.
That's incredible.
Yeah, it really is. And so I started running barefoot. This is all in my book, Lifelong Running, how this came about. But to me, it's the most natural thing to do. And anything we do that's natural is usually going to be better,
Now, do you run barefoot on asphalt?
Oh, yeah. Yep. And that's one of the other myths, that don't run on asphalt because the impact is bad for your knees or all your joints. As it turns out, it's the impact that strengthens your bones. When you hit the ground like that, that shock wave goes all the way up from your legs to your spine to the top. And what it does is stimulate the osteoblasts, which are your bone-building cells. Bones are crystalline in nature, and that impact actually is good for them. So that's why running barefoot, even on asphalt, is not a bad thing. And one of the reasons why my bone density increased through my 50s and 60s at a time when everybody, quote, knew that you'd be losing bone density. I increased. And this is no dairy, no calcium pills,
Right.
no supplements of any kind except B12.
That's amazing.
Yeah.
One thing that's coming to mind is, did you find when you made changes in your running program, let's say with different shoes or going to barefoot or perhaps increasing distances, would you have brief periods where the body would kind of adjust to that? You might have a little soreness or a little pain. And do you think that sometimes runners perceive that to be an indication that they're harming themselves, but it's really just a short-lived adjustment the body is making?
Yeah, if you do too much too soon, you do have a little more damage to the muscles, and you have what they call DOMS, delayed onset muscular soreness, and the muscles do recover and they get stronger, so that next time they're ready for that additional load. You can avoid that by gradually increasing and keeping track of how much you increase. And that's hard to say because we're all individuals in terms of where we start with our fitness level.
Right.
I never did really have much soreness except my first downhill half marathon, a Kole Kole Pass on the island of Oahu. And this is steep, 13 miles, almost straight down. And I hadn't trained to do that. Well, the next day, I could hardly walk. But the next year, when I did that, I didn't have any soreness. And
now
the
that's
next
interesting.
year after that.
Where were you sore from that? Was it in the shins and the knees, or where was it?
Oh, boy, quads primarily.
Well, okay.
Yeah.
Okay.
Yeah.
That's fascinating. One other thing I was going to ask you, when you run, this is probably in your book, but are you running for time? Do you have a Garmin? Do you use that kind of thing, or do you just run for fun? You don't really care where you finish, or?
Well, it's a combination of both. I try to run an hour a day, and I do have one track workout a week where I go to a track and really push hard, where I'm definitely anaerobic and thinking, why am I doing this? And when I finish, I pat myself on the back and say, that's why you're doing it, because you feel so good and you beat last week's time. And so there's that aspect of the time, trying to keep my speed up and then putting in at least an hour a day of running. I also spend an hour a day on the bike. It's a stationary bike primarily because anybody, I guess, would get bored out of their skulls just sitting there pedaling away on stationary bikes. So I do the mental exercise at the same time. I do a Sudoku every day.
While you're cycling.
While I'm cycling.
All right.
After, if the Sudoku's easy and it's not an hour yet, then I do crossword puzzles or read journal articles, or it's my mental as well as physical exercise. And I think that's equally important. What good is it if we're healthy from the neck down, but our brains are not up to?
Yeah, that's good. That's good.
Really important.
One thing I was curious to ask you about is, Dr. McDougal has this vegan diet that has been so successful for so many people. And I think one of the things he tries to address is the difficulty that people have. At least when I hear him talk about a raw food diet, it seems like his feeling is that it's so far from the SAD diet that he kind of focuses on cooked vegan.
Oh, absolutely. And in fact, his last book is The Starch Solution and says we are starchivores. And I think for most people, it works fine. I don't know. I've never really talked to him about the raw diet. I just know that
it worked for you.
Oh, it's so easy.
Yeah. One thing that we touched on a little, and maybe you could say a little more about it. fortunately, your husband took this diet with you and went with you, no problem. A lot of people aren't that fortunate, but how do you guys do when you go to public events or go out to dinner with folks? Does it become an issue at all, or is it no problem?
Um, it has become an issue at times, especially with our families. And
Yeah,
unfortunately, you know,
they don't get it.
they don't, and I don't know what it's going to take. My son had a higher cholesterol than he should have, and he asked me about it. And I said, quit eating it. But I noticed he didn't. Um, it's really sad when you see your own family.
Right.
In terms of social, most of our friends are vegan. And when we go out, any restaurant, and I cover this in my cookbook about eating out in a restaurant, there are always side dishes or appetizers that are vegan. You can always
Right.
ask for 3 or 4 side dishes of veggies or
Yeah, that's great.
yeah, and they always have salads, even if it's a iceberg lettuce and tomato. Well, eat that for the time being and fill up on the other veggies. And for dessert, plain old fruit. That's the main thing. I started to mention berries. I think blueberries, blackberries, any kind of berries have been shown to be very high on the antioxidant scale and good for our brains. So I don't want dementia, so I eat berries every night for dessert.
It sometimes happens with raw fooders that they end up incorporating a good bit of dried fruit in the diet, and then they end up having some teeth issues. Have you ever encountered any of that, or has it not been a problem?
Not been a problem so far. I do take good care of my teeth.
Yeah.
My dentist, when I open my mouth, has said to the dental assistant or hygienist, see, this is how I wish all my patients looked. And I thought, wow, that's kind of neat.
That's
I
great.
do floss after every meal, which I know most
Okay.
people don't. I use a water pick to flush out all the food particles as well as brushing. So I think that's really important, taking care of our teeth.
And do you take vitamin B12 or vitamin D?
And not the vitamin D because I do get a lot of sun. The
Yeah.
B12, absolutely. Yes.
Okay. Yeah. Wow. And is there any other supplementation you do, or is it just
No,
the food?
no, just the B12.
Hmm. And do you find when you get into a period where you're doing extensive running, like say preparing for a triathlon, do you find that your desire for calories increases?
Oh,
You start eating?
definitely.
Yeah.
Yeah. And in fact, that's another myth that athletes need more protein. What happens is as you exert more energy, your appetite goes up, and automatically you will get more protein just by eating the same ratio of your carbohydrates to fats to protein. It's simple. By
Right.
taking protein powders and upping the proportion of protein in your diet, you're shorting yourself on the carbohydrates. Carbohydrates are the fuel your muscles and brain, by the way. Your brain goes only on glucose.
Right.
And that's why it's
And
so simple. You don't need to change your diet if you start running. Just eat more.
and the excess protein
Oh,
causes problems for the kidneys and osteoporosis. Yeah. So,
yeah,
uh,
yeah.
well, I tell you what, I could keep going. You probably want to. You probably have other things to do.
That's getting
Could you?
close
What's
to
that?
supper time.
Right. I wonder if you could say one more time for the viewers your website, and if you would, since you have 4 books, perhaps you could name the titles of all the books. I will, when I edit this, provided I can load it onto YouTube the way I want to. I will put a text note in here that will list these things, but you go ahead and say them so people can hear them from you.
Okay, because all the information I've gained, um, I've put in the books when I've had time to think about it and add things and rephrase things. So when I'm interviewed, sometimes I think afterwards, oh, I should have said this, or I wished I thought of that. Um,
You can't get it all in. You
yeah,
just
I
can't.
know.
Yeah.
But it's in my books. And the first one is A Race for Life, because with the breast cancer diagnosis and the way things turned out, introduction to Dr. McDougal and the Ironman Triathlon, it just couldn't have been programmed better. And it became my race for life. And the race for life we are all in. So all that information is in there. What I did and why I did it and how to do it yourself is in that. And then when I started giving talks and put up a website, people would ask, well, what's wrong with yogurt, for example, or fish, and how do you get enough protein? What about the calcium? And what do you eat oatmeal, and how do you fix kale? So I put together my favorite recipes, CHEF. CHEF is an acronym that stands for cheap, healthy, easy, and fat-free, and fast. You know?
Nice.
Yeah. So it's an ebook now. It's available through my website, through PayPal, $5. And I get requests from this morning, the Netherlands and Australia, 2 ebook orders. So the word is spreading worldwide, thank goodness. And then my third book, as I mentioned, was Senior Fitness and how to eat to overcome all these diseases that most seniors are subject to and reverse them. And then the fourth book, of course, Lifelong Running, where Martin and I are trying to get more people running because we know the tremendous benefits of getting an effective and efficient exercise. You can run any place, anytime. And in terms of my next book, because there's always things that more things I want to say about how much fun running is and how beneficial it is when you travel. I'm long time retired now, and I get to do pretty much what I want to do. And traveling is one of them. And I have been around the world twice. Once on a ship, 4 months on the Rotterdam, going completely around the world, and once 30 days on a jet plane. It was our own custom jet crew and all that. And the objective was to run in all these different places, like Machu Picchu, around Stonehenge, the Great Wall of China, all over the Galapagos Islands, just to show people how much fun running can be. And that is so much better than getting on a tour bus and being shown these places. In fact, when I was in Athens, we did the tour of the Parthenon and the Plaka. And the next morning, I went out for a run early, no crowds, got to these places by myself and thought, oh, this is so exciting. This is wonderful. And this is the joy I want to talk about in showing people some of the pictures of running in different places and seeing them. I haven't been to the Antarctic. That's next on my list, places that I want to run.
And does your husband do triathlons with you?
He did one. He doesn't like swimming, and somebody told him that there were sharks in the ocean, and he said, that's it, I did it. But he's a dedicated runner.
All right. Can I ask this just so that our viewers I don't want to ask this to be impolite or rude. I just want to ask your age because I think it would be useful for the viewers to know how old you are and that you are still doing all these things.
I am 78 years old, and I have to admit I'm looking at 80 and thinking, oh my goodness, it's going to all fall apart when I hit 80. But then I thought that when I was 69 looking at 70, I thought, well, that's the end. I remember 49 looking at 50 and menopause and thinking, well, that's it. And it turned out that each decade had so many more advantages. When I was in my 50s, I was being sponsored by Continental Airlines to do the Ironman in New Zealand and the Ironman in Japan. And when I was in my 70s, I was asked to be in this movie, Forks Over Knives, which if anybody hasn't seen it, please see Forks Over Knives. It's not just me. It's a documentary that has convinced so many people to change their diet. It's a wonderful, and doing a movie in your 70s, that's not bad. So maybe when I hit my 80s, it'll it'll get better. I'm hoping.
Now, I know for most of this interview, we've focused on the health aspects of this diet and this
Right,
approach to life.
right.
I wonder, do the ecological and ethical aspects of it, do they play a role in your decisions
Oh,
at all?
absolutely. It hit me between the eyes. My gosh. I was never aware of those aspects before, but once I got into it, it seemed to sharpen my sensitivity. All of a sudden, I felt a kinship with animals. I'd go running
Yeah,
in a farm and I'd see a cow and I'd want to go up and stroke it and pet it and think, you poor thing, what they're doing to you. It's the same way you'd feel if a dog was being mistreated. And why people differentiate between the different species of animals, I cannot understand. And once I
right.
learned that fish had feelings, that fish learn, uh, went to an aquarium once and I went up to close to it and was looking at the fish and I did this, moved my fingers, and the fish went along with it and it moved back and forth and it seemed to be playing a game with me. And
Oh,
we
that's
know
beautiful.
that when they're hooked, that pain is the same you'd feel if you got a hook in your mouth. So I am so dead set against fishing, even the catch and release. And in
Yeah,
terms of
yeah.
the environment, there is absolutely no question that with the clear cutting of forests, the rainforest destruction, that I'm not sure we haven't reached the tipping point where we've destroyed so many of the lungs of our planet that it's just really sad.
Yeah, yeah.
That's my grandfather clock.
That's 7 o'clock, isn't
I
it? Or well,
love
it's
I love antiques, things that are old, and it's a good thing because I'm gonna be one of these days. But anyway,
I don't think
clocks.
so, Dr. Ruth. I don't think so. I think you're I think you're just such a shining example of health. Um, what was that? The other thing I just wanted to ask you. Well, it's escaped me, but it's just a real pleasure talking to you. You're just a fountain of information, and I appreciate you taking the time. Is there anything else you'd like to add?
Just, I don't know what it's going to take, but I'll do anything to try to show people that this works. I'm not making any money off of it. I'm not selling anything except information which really has its basis as education. If we could educate our kids, starting from the time they're breastfed, which should be until they're 2, 3, even 4 years of age, and then being fed plants. If we could educate our kids about not only the health, but also, as you mentioned, what we do to our fellow beings on this planet and our environment, I think we'd solve the problem. So let's educate the kids.
Amen.
Yep,
Amen.
yep.
I remember what I wanted to ask you. Did you become a doctor of nutrition when all this happened, and did you decide to study, or what? Were you already a doctor of nutrition?
I got my bachelor's from UCLA, I'm proud to say, because it was hard work and really worth it, in psychology. And that
Aha.
had been my direction. I wanted to be a psychologist to help people. I wanted to be a clinical therapist and help solve problems that were all mentally induced. Got my master's in psychology and did a couple of clinical internships and started finding out it's not working. It's all this counseling, and I wasn't seeing a lot of results. So I thought, well, I'll get my PhD. So I went right into a PhD program, and that's where I was when the breast cancer hit. And
Aha.
that's when I thought, I've been barking up the wrong academic tree. And remembering what I was taught in nutrition in my freshman year and the difference now. And so I took a whole bunch of nutrition courses and exercise physiology because I knew that was working. And that became my PhD, and my dissertation was about all this research put together on how to live a long, healthy life with diet and exercise. So, yep, that was why I went into the field I did, and so happy I did.
Fantastic, fantastic. Well, Dr. Ruth, thank you so very much, and perhaps sometime in the future we could do it again if you have another hour, like maybe a year down the line or something, and we'll see how many more triathlons you've done. And
Okay, and thank you, Paul, for doing this, helping us get this information out to more people. I'll put you on my website too.
You're an inspiration. Thank you so much.
Thank you.
All right. Take care.
Yep, you too. Gonna hang up.